You're listening to another episode of All the Bees with me, Dr. G, and my scrub tech, Bree. Welcome back. We are nearly ready in our office to have an intervention where we say, we know and love you, Bree, but you're not allowed to use the word slay anymore.
I just got back from a trip, and I'm pretty sure my vocabulary only consisted of the word slay. And then my daughter gave me a Mother's Day thing she likes about you. And the top line, I have a picture, says, I love my mom because she slays. And I was like,
Oh,
okay.
fitting. Yeah, I
So
think
fitting.
our anesthesiologist he's gonna start one of those coin jars where every time you say slay, you have to put a quarter in or something. I don't know.
Right. Yeah. Or go to therapy, but.
But we're back, and today we're going to talk about Avéli, which is a cellulite reduction treatment that we like a lot in this office. Did we do 3 of them that Friday before you left, I think, or
We
2?
did.
We did 3 that week, yes. But first, we have to dissect the current events and not the depressing kind. So I feel like we might kick off with the Met Gala because it's
Okay.
topical.
Let's do it.
I would say my first disappointment was to see that Rihanna was pregnant again.
Again. She's like, I guess she's not going to be at Lollapalooza, is she? I was like, you never know. She slayed at the Super Bowl pregnant. So, I said slayed again. Dang it.
We're just
Um,
I feel like it matches the number of times I drop a lap on the floor when we're operating. Maybe it's
oh yeah.
it's
You
matching
should have
my
seen us
energy.
yesterday, back day one after vacation.
Another lap down, another
And
lap
another
down.
one. I feel like she just retired so she could whip out a whole football team. I feel like she's going to be the female version of Nick Cannon without all the baby mamas.
I know. I mean, she looks gorgeous. I'm simultaneously excited for her and upset that we're not getting either a new album or at Lollapalooza when I'm there to see ASAP Rocky, that she's not going to probably bounce onto stage.
I
Probably going to
bet
be
she
on
will.
bed rest or something. I don't know. She's pretty pregnant there.
I give her high hopes. Her outfit is very close to Kylie Jenner's outfit. Like the skirt they both have.
I mean, I will have to say that this Met Gala with the black inspired, tailored look got people all on the same page. There wasn't there were a lot of pinstripe suits. There were women wearing suits as deconstructed or the front of a suit. I don't know. It was interesting, but a lot of the same theme. I mean, Zendaya and that one girl basically had the same 3-piece white suit on. Everyone,
Yeah.
there was a lot of the same looks, which is tough because I feel like there was some room for creativity. But then when people vary too much, then we're all like, wait, what? What's that?
Right. You were either in a pantsuit, a skirt, or no pants.
Yes,
That
no
was
pants, definitely. Speaking of Avéli, no pants look was quite the thing on the Met Gala. So if
sponsored
you're
by Avéli.
if you're wanting to show off those gams in a formal setting, literally in panties and hose, then yes, maybe Avéli is probably your next stop.
Avéli and Slay.
I don't think we have any other I feel like I saw an article about Halle Berry and plastic surgery and her presence at the Met Gala, and I thought, what? She looks
Hmm.
great and she didn't look overdone or undone. I didn't love her dress, but I don't know.
Yeah.
I feel like sometimes people are just trying too hard about the plastic surgery connection there.
Yeah.
So
I know the first thing my mama asked me, she was like, has Demi Moore had a facelift? And I was like, don't you listen to our podcast?
apparently
We have
not.
addressed her, I feel like, so many
Yeah,
times.
she's had at least 2 facelifts, and then the lip lift that is not was not it.
I do have to say, Anne Hathaway, okay, I know we weren't going to talk about her, but I just remembered something. She has incredibly pointy ears.
Oh, you and your
Can we pull up
ears.
a picture? I don't know. You know how That's my thing.
You have your
Can we
Nicole
pull up a
Idman.
picture? Yeah, her earlobes are huge, but I feel like I saw her in a picture and her earlobes were so pointy. I was like, this kind of looks like it was cosmetically
You think she had her
done.
ears done to make them elf-like? Body modification?
Yeah, ears and like the little pointy collarbone that I want to have. They looked
Okay.
very pointy, right? Or am I tripping?
Yeah, again, I didn't love her outfit, it was fine, but yeah, it looks pointy. I mean, I think one of the tricks to, looking great on the red carpet is to have your hair pulled up like that because it definitely is, kinda like a
It's like the
mini
face tape.
facelift. Yeah, gotta hide that face tape. So, yeah, her ears do look a little pointy. I don't know, but they're not
Not as
surgically altered. Also, she doesn't have any earrings in because she doesn't wanna distract from the necklace, which is fair, but
yeah.
it's
She
a
looks so
risky
good.
run when you pull your hair up, is that everyone will then
I know.
look at your ears.
I know. Maybe I saw this video where she was turning and I was like, "Oh,
Not
okay."
the angles for the
Not the
ears.
angles. Okay, we can move on from the Met Gala. I've said my piece.
Yeah, so moving on to less, favorable. Yeah, so we're gonna talk about Katy Perry just because I really thought, well, we talked about her in the terrible space trip, but then her current tour, her opening night in Mexico City, I thought it was like an SNL skit or a throwback to sometime in her early days, question mark, where she was dancing, and then I was like, "Oh, no, this is, like, current." I mean, I feel like you could throw me up on stage and I'd do better, and we know Bree has tried many times to teach me how to twerk, and I'm
I have videos. Lots
really
of videos.
not good at it, but I feel like if I knew I had to do a world tour, and I'm sure I could spend some hours in the studio and figure it out, right?
Right, exactly.
I
Don't go
don't
on a world tour if you don't know how
to
to dance.
twerk.
I don't know. Like, I know Taylor Swift puts on a phenomenal show, but she also, like, she may not be able to dance very well, but she puts on a great show. Katy Perry, I feel like the next thing she's gonna come out with is, like, space tour sex tape. Like, it has to be, like, a bad threes because she can't go to space. I don't know if she's trying to stay relevant, but
She's
I
having a
mean,
midlife crisis at 40, I don't know, but the
someone took her
choreo
lorazepam and then tried to dance.
yeah, because she also was, like, going through the moves, but no energy in the moves. There's all these memes now because one of the moves is her cradling a baby, and it's just, like,
Like, what is
what is
that?
even and what is happening? Like,
Oh
she's
my
just
god.
standing there in those boots. I don't
My
know.
10-year-old can whip out dance moves better than that.
It's
What
crazy. Yes, there's the cradling the baby, and then there's the I can do that twer
oh,
but she's not
no.
twerking. She's
Katy
just
Perry.
doing a football run with her butt facing us.
I revoke it, send her back to space.
Yeah.
She was meant
Ugh.
to be. Wow, you know what? I wonder if that
Oh,
was
yes, this
connected.
was my best part actually because she does the dead drop. Not the dead drop, Jesus.
At least her labia stayed in.
I can think of a plastic surgeon for that probably. But, no, she does the death drop. So that's a move, right? And
Never
instead of
heard of it.
just committing to it, I mean, you have not watched Dance Moms, like I've watched Dance Moms. It's a known thing. It's actually originates from, drag queens. But anyway, she does that last move as a death drop, but first she has those 2 people come help her. Like, they hold her arms so that she doesn't do the death drop. And then ironically, some little kid at my youngest daughter's school enacted a death drop at their most recent school production. So it was like some sort of play. And she's like, yeah, Astrid did the death drop at the end. Which,
Wow.
so if, a 13-year-old can pull it off. And how much are these tickets going for? If you're going to pull off that choreography, I want to see that, you've done a season on Dances with the Stars or something where you've learned some technique. Cause,
Yeah.
or don't dance. I don't care. There was another
Yeah.
scene of her running around, like literally running a lap around the stage. But she's bounding and she's going kind of slow. It's just so weird. I know that
It's
doesn't have
giving
anything to do with plastic surgery, but the whole thing is so bizarre. And her hair looks weird. The whole thing is weird.
I wonder if, like, her going into space was a setup for her galactic space tour. I wonder
I'm
if she was
sure it
trying to,
was.
like
She was trying to tie it all in, but
hmm,
and she has a handheld mic and a headset mic. Like there's so many like weird things.
it's
So
just all bad in so many ways.
she just should have stayed. Yeah.
I love how they said it's giving school talent show. Don't throw school talent shows under the
That's what
bus
I'm
like that
saying.
because I
Astrid is
sang
coming for
I'm a
you with
Barbie girl. Yeah. I slayed. I eat. I slayed. Slay. I sang it to you the other day in the OR.
That's right, you did. Yes.
I'm
Our
a Barbie
singing.
girl. I also whipped out a whole
Oh, you whipped out some
of
M&M,
Eminem.
Slim Shady. You knew all the
Yeah,
words.
I did. While we're putting
Shockingly.
the patient in their garment.
Mom spaghetti. Okay.
Knees weak, arms are heavy.
We're going to move on to Ryan Reynolds fake tan, which is so good.
Okay, I have to
Finally, we can
think.
talk about, wait, I have to say, finally, we can talk about Ryan Reynolds and we're not going to discuss the lawsuit. This is just completely unrelated.
Don't say the name. There's no. Okay, that's either a terrible, terrible spray tan or he's doing that like intranasal type
Yeah.
stuff
The stuff
that
that
turns you
one
orange.
patient of ours had that made him orange, right? Wasn't he taking something?
So orange. Yeah. He was putting it up his nose and every single time. And it wasn't like a beautiful tan. I mean, this shit was orange. Crap
It's like
was orange.
day glow orange, you've eaten too many carrots, but there is something you can take that supposedly gives you this tan, but the tan always comes out looking orange.
Like you got a spray tan after being completely jaundiced. Like I don't like the color combo doesn't sit well.
I don't know what, yeah, just wash it off, bro. I don't know why we're looking at this orange Oompa Loompa situation with Ryan
I
Reynolds.
know. He looks kind of like Harry Potter.
Oh, because of the glasses?
Yes.
It's so weird. And he
Yes.
also looks like sloppy, even though I don't know.
All this is giving what is it? What's the other Ben? Not Ben Affleck, Ben
Stiller,
Stiller. Is that the guy? Happy Gilmore. Who is that?
Adam Sandler.
Adam Sandler.
Wow.
I'm not great with names.
Yeah, sloppy.
Not Adam Sandler sloppy, but that's who I was thinking of.
All
When
right.
you know this guy is just worth a gazillion dollars and he's coming out here in basketball shorts and like some holy t-shirt.
Right. Except I'm sure every piece of clothing he's currently wearing is expensive. It's just styled weird or not
He should have just
styled.
worn the white see-through shirt just like with nothing underneath,
The whole thing's weird.
honestly.
Well, then you would see more of his fake tan, so
I
really
know.
not really
His
wanting to go there.
jaundiced orange fake tan.
And then I did point out that his entire body looks like your hands after you do your own self tanner.
Wait, I'm really tempted to take my shoe off right now and show you guys because I did self tanner and then I went on vacation. And even my daughter came to my bed last night and she's like, "What is wrong with your feet?" And I was like, "It's just self tanner coming off." I'll
Oh,
put a picture in the chat.
oh no. Yeah,
Unless you want me
so
to get my leg up here.
one of the side effects of self tanner is your feet and hands are really hard. Even when you go for a spray tan, feet and hands are really hard to get right. It's the giveaway that you've engaged in some self tanning
And I'm
shenanigans.
convinced because we use so much sterilium and like I
Mhm.
mean, our hands are so dry all the time. We're constantly putting alcohol, surgical scrub on our hands every day that like I think even if I lather it in lotion and like Aquaphor, like it sticks. So
Mhm.
she was at an event and she sent me a picture of this little, let's see if I can pull it up on my phone. Please hold. And she's like, "This looks like your spray tan." And I was like, "Wow."
Yeah, so I was at an event, and one of the things they were serving were chicken drumsticks.
That's what she said a my soft tan looked like, if you
With the
can see
foot
it.
still attached to the drumstick, which I was took a hard pass on trying that.
Yeah, I was like, first off, who was serving that like that?
They ran out of the chicken nuggets with caviar, and so when I
Okay.
rolled back, they were like, "Yeah, no, we're doing these," and I'm like, "Is that the foot?" And second, I need to text a picture to Bree to let her know this is what her hand looks like when she's done self-tanning. Ay, ay,
It's
ay.
really bad.
And then I was
Sometimes
like
she'll go in and be like, "Ignore it," to when we're seeing patients, and she'll be like, "Yeah, just don't look at Bree's hands." And I'm like, "Where's HR?"
whatever. At the same time, you're probably scrutinizing their ears, so it's all win.
Facts.
All right, let's move on to, Christina Aguilera's face. Again. I feel like we're always talking about her face. Girls trying to be relevant. I would say, who was looking at her face? Why is she wearing a weird bikini over black leggings?
I know,
More
that
than
was the
anything
first
else.
thing I saw.
No one's looking at your face. Uh,
She's giving a Madonna vibe, like
mm,
Madonna facelift,
yeah.
midlife crisis.
I just think the only thing that looks different between her now and maybe 6 months ago when we talked to her when we talked to her. She's not returning my calls.
Hey, Christina. So,
When we talked about her 6 months ago where, around the same time Lindsay Lohan had debuted her also what did they call it? The undetectable era face. That now she
yes.
just looks like first of all, it's a lot of it is makeup, and then the second part is that maybe she had a lip lift, and that's what's changing her appearance. So if we scroll down and take a look at some of her other images, I think I think that's catching on. It's becoming more and more popular to do an upper lip lift at the same time as a facelift, and I think, and again, scroll down a little bit
She looks
more.
snatched though. Like,
Oh,
she looks
I just
like
think
all
it's
that was pulled back. Her
yeah.
jawline.
Of course, they're photoshopping the bejesus out of this. So, like, what's going on with her arm on the one side? It's too skinny. Like, it's not
Oh,
even
yeah.
like, I think they just photoshopped it. It's
She has, like, a
weird.
whole different face shape.
But I'm telling you, it's the lip lift is adding to the upper lip looking funny.
Yeah, and she lost a ton of weight, so, I mean,
Right.
there's
But
no way you don't lose all that weight and do nothing.
everyone should take a cue from Demi Moore and not mess with the upper lip lift if they don't need it
Mm-mm.
or hide for 6 months because it's going to look weird until it
Yeah, I mean,
settles down. I think it's a great operation when you're doing a facelift in someone older, but in these 40-year-old people, I think an upper lip lift will look unnatural for a little bit.
yeah.
And then one of my friends often is comments that in addition to an upper lip lift, which the incision goes at the base of your nose and the excised skin between your upper lip and the nose, a lot of patients will need a corner lip lift to balance it out. So that's a little incision at the top of your upper lip at the corners to evert that. Because if you don't, then you just get kind of a central pull, which is the Demi Moore effect right now. So I just think, you really have to talk to your surgeon about it. It's just not like, oh, everyone gets one.
Right.
But she looks good still. Just, whatever. Skinny and
I love.
she doesn't care. She's giving the I don't give a fuck.
I know. I'm so surprised how skinny she is.
She's, taking that probably Ozempic like the rest of us.
Right. Slay.
Slay. Okay, moving on. I think we also were gonna talk about face taping a little bit,
It's
trending on
trending.
TikTok.
I can't ever imagine though going out doing that. Like, are
Yeah.
people not
Can't you see it?
seeing? Yeah, like that would only work, I think, if you maybe wore a wig.
And or you were on a photo shoot where they were making sure that no one can see your tape. I know
Yeah,
it's
like
it's a common thing for, like, red carpet looks or, like, maybe a photo shoot, but, you actually have tapes stuck to your head and wrapped around the back. Like, come on.
Imagine going on a date and then you go home with the guy and you like, "Hold on, let me take my face down." And you just start remove like, that would be so that has to be just like a model thing, right? I saw one episode on, like, The Housewives, I don't remember what it was, and she was like, "Oh, my face tape fell off," and she had to, like, retape it back at a coffee shop, and I was like, "Girl."
Yeah, it's not really, really effective,
I'm just trying to
from a
think.
practical standpoint. But maybe we should try some. It would be
We should
fun.
try some. We'll do a photo shoot.
Okay, we'll buy some face tape and see
Good, I got
what
your
it
credit
looks
card.
like.
Let's do
Let's
it.
do it. It's Nurses Week, so maybe in honor of Nurses Week, we'll get face tape for
Happy
everybody.
face tape. So I know you guys are all really tired and exhausted and wrinkly, so we got face tape for everyone.
You're welcome. Ah, okay.
Okay.
Avéli, let's move on to the meat of this. So Avéli's been around for probably 3 or 4 years now. I think I was at a conference and I was like, hey, team, what do we think? Do we want to get this on board at our practice? And I got a
Yes.
resounding yes.
Yes.
So it's not the first cellulite treatment that's been available, but it definitely is the most effective one that's been available to date. So there has been an evolution of things to get rid of cellulite before. There was something called cellulase, some devices that were like kind of attached to a big laser machine looking like
Oh.
thing. It was like 100 grand. It suctioned the cellulite dimple up, and then a blade went in there and kind of cut the fibrous septae. It just wasn't very precise, so it wasn't as effective as Avéli was. And then in between the development of Avéli and these cellulase treatments, we had Quo, which was an injectable collagenase. So you could like inject it in the area of the dimple and it targeted and dissolved the septae. So sounds awesome in theory, and it had problems. So it was pulled off the market. One of the
Hmm.
issues is in dissolving things. There was a lot of bruising. It's, not controlled. You're just sort of injecting and hoping it does its thing. And so with the bruising, some people got hyperpigmentation, like from the bruising, which was not ideal. So now instead of cellulite, you have this weird brownish shadow where your cellulite was. And then it
Oh.
just wasn't as effective. I never used it or offered it, but it definitely was popular in the derm community and some plastic surgeons offered it. And so right
Was that
about
still the same where you could only use it on your butt and thighs?
yes. So that's what it was approved for. So it came to market and then it didn't last very long. So Avéli has been around now probably 3 years. It's was owned, I can't remember by whom, but it's been bought out by Tiger Aesthetics, the people who own the Sientra implants, and also who are coming to market with Alaclay, which is a injectable fat off the shelf. So all of these things are relevant.
Mhm.
Well, not the Sientra implants, but the Avéli and the Alaclay are relevant because a lot of times when you're treating cellulite, you're attacking multiple issues, right? So you could have a little bit of localized adiposity, like little fat bulges. You can have actual cellulite dimples, and then the big problem, which is skin laxity. So laxity is really hard to treat. Now we have something for the cellulite, and, for little localized fat deposits, oftentimes we can do targeted liposuction. So, you've seen me do Avéli. I would say this is a treatment that is that we're showing right now on the screen is pretty consistent, right? With what
Mhm.
the results we get.
Yes.
It's not a magic eraser. So, you know, you're not going to look like Sabrina Carpenter's legs on the Met Gala carpet with no pants. If that's not what you're starting with, and she probably has, some sort of manual lymphatic massage and a bunch of stuff done right before and whatever. It's not Photoshop, but it definitely takes out the dimples or a lot of them.
Yes.
So you can see definitely in this patient, she has a kind of dimple right in the middle of her lateral thigh. And I bet that really bothers her. And it's one thing people are, women will say, oh, well, I'm not embracing the pantsless look. But if you are wearing leggings in any color but black, a lot of times you can see that cellulite through the leggings and it bothers women in that respect. So
Right.
addressing it from just wearing clothing that might be form fitting, and then you're like, great. Now you can see my cellulite through my pants. That's not ideal either. What's your 2 cents about Avéli, having watched it done?
I think Avéli is great. It's like a easy in-office procedure. I mean, I'm not gonna say easy, like, it's not painful, but, I mean, they're in and out in, like, 2 hours. Everyone is pretty happy with their results. I obviously know that you want my medical rundown of how Avéli works
Oh, yeah, do
because
it.
So, we have another stick. Um, Renuvion and Avéli, the 2 sticks. So, basically, you come in for your appointment, she marks you all up, puts a bunch of drawings around the ones that you want done, takes you back, you put in a tumescent, kind of the same thing as the way Renuvion is done. That's all the numbing stuff made with lots of love. And then there's this little wand, and it has a little blade on the end, and she shoves it up there, obviously, much nicer than that. And she opens the little wand when she gets to the dimple. There's a little light on the end where you can see it's actually really cool. You can see exactly what like septa that you're about to be cutting. She goes in, she cuts it. They do like some double checking. She goes through it like 3 or 4 times to make sure that band is all cut. And you can like see it right then and there. Like it's a pretty cool little thing. And everyone's super happy. Some people bruise, some people don't bruise. But, yeah, I feel like it's pretty, fail proof because
Yeah,
you
you
know
could
exactly
see.
what you're doing. Yeah.
You just have to be precise, and when I go in and target a cellulite dimple, I'm hooking, cutting the septae. A lot of times there's like 10 little septae at each dimple, so I have to go hook, cut, hook, cut, hook, cut, and then I need to keep repeating that until when I pass the hook, it doesn't catch on anything.
Yeah.
And that can be a little tedious for both myself and the patient. So it's great for the first few. And then after you're lying on your stomach awake for a while, you're like, ugh, okay, I'm
Yeah.
done looking at Instagram. When is this over? It can, depending on the number of targets, that can take a while. I think one of the reasons something like Quo was so popular was because it was an injectable. And when you're training to use this device, for me, we do Renuvion, we do liposuction. I inject tumescent solution all the time. And that's if you're a derm and that's not something that you do, you're like, wait, what? What do I have to do? I have to put local in and make an incision and inject tumescent solution. And then I get to go to target the cellulite. So I think it's a little more daunting if you're not surgically inclined or you don't do a lot of surgery. That might be a little out of your wheelhouse. But it's very effective. The downtime's like a week. You should take it easy. We tell people to wear Spanx afterwards. The reason is so that you don't incur more bruising. You'll leak that tumescent fluid for a day or 2 because we're not suctioning it out like we normally do with liposuction. Here's the device. Yeah. Okay.
Cute.
And then this is our demo. So I'm woefully unable to get the light off once I turn it on, but
You have to do the clicking.
yeah. So when you're having the procedure, you're like, what is this ratchet noise? But it's me pushing, look, it's like a little lightsaber, pushing the device in, and then I that's the hook part. So then I hook, and then if I catch on something, then I depress and a little blade comes out. Imagine the blade, and then cut, and then I have to slide it back so that the profile is thin like that to pull back and then go back out again. So there's a lot of like hook, it becomes a rhythm, right? Sort of like twerking.
Yeah.
Just
I
kidding.
got the twerking part, she's got the Avéli
Yeah,
part.
I can't twerk, but somehow I can manage to do this. So, all right. So you push this in, hook, cut, slide it back to slide back out. And so, like I said, there's a lot of clicking as I'm doing the procedure. And then the little light at the end of the device, which is glowing right now, helps me know where I am because I don't want to be too deep. Kind of want to be a little bit superficial and I want to be at the targets that I marked when you're standing. The good news, the PSA for everybody, is that I have to mark people when they're standing. And then when they lay down, your cellulite almost always disappears.
Mhm.
So, if you're at the beach and you're laying on your belly, just know no one can see your cellulite because it looks, for the most part, it really disappears when you're laying flat, whether you have it treated or not. Speaking of areas, I usually treat buttock and posterior thighs. We don't like to treat the banana roll area because it's that little area right under your butt, that little gluteal crease area. The skin, the fascia, everything that's tacked to the muscle there is kind of supporting your butt. And so if you either aggressively liposuction that or release too many cellulite dimples, the support for your butt goes and your butt will drop. Nobody wants that.
Mm-mm.
Um, it's not approved for anywhere else on the body. You don't really get cellulite anywhere else on the body. A lot of times patients will ask if I can do their anterior thighs. And what they're talking about is laxity. And so, no, me releasing those septae between your skin and your anterior thigh muscle and subcutaneous tissue is just going to lead to more laxity. But I did make an exception about a week ago for a lady who had a couple legitimate dimples on her inner thigh that you could see from the front. And I said, "Well, I'll have to make a weird little incision to get to that. It's not going to be in the gluteal crease, but we can give it a shot." I mean, like the worst thing that happens is it doesn't do anything. And she had one on each side, and I saw her back while you were in Alaska, and they're gone. It's amazing.
That's awesome.
So I
I know
think
that was the first thing I said. I was like, "Are you gonna do those?"
I was
It's like,
like,
"Why is her front marked?"
I was like, we're gonna give it a shot and see because it was like definitely a cellulite or some weird little dimple. It wasn't laxity. So we targeted those two areas and she did great. So and our first patient was a weight loss patient. So she had some cellulite, but quite a bit of laxity. And for that patient, we injected dilute radius, which is a biostimulator.
Mhm.
So, if you have a budget for it, I would say combination therapy is usually your best bet because even in that photo from that article we demoed, the patient's only problem is not cellulite. There was some localized adiposity, there's probably some laxity. And so, if you want to address all of those things, multimodality therapy is usually the best. And the thighs are hard. We talked about thigh lift last sesh.
Don't get me
Thigh
started on a thigh lift.
Thighs are rough, man, because you're fighting gravity. People leave them exposed to sun, whether you're at the beach or in shorts. And yeah, you're constantly fighting take the pounding if you're working out, if you're a runner, all of that reduces the collagen and elastin in your legs. No one's applying retinol to their thighs. The skin is thicker there. There's lots of reasons why the thighs age, and then trying to reverse
Yeah.
that aging is tough.
It's the hardest part of the body.
Really is.
You, I assume, wouldn't obviously do lipo in the posterior thighs or the butt. So would you combine it with Renuvion, or is there
No, we've combined it with liposuction before, because the cellulite dimples are more superficial, and we've definitely combined it with Renuvion for skin tightening.
so when
The
you're doing lipo, it's deeper than where you're going to cut the septum?
Yes, yeah. It's not common that we do the 2 together, but it can be done together. And then Renuvion for sure, because it's tightening the subcutaneous tissue, so that generally makes everything better. We like to tighten the skin. I think the one thing Renuvion doesn't make better is crepey skin, right? Because if you think about it, it is like if you had tightened the sheet under a blanket and then you like pulled that tight and you didn't do anything with the blanket. The sheet looks great, but the blanket just gets wrinkly on top. And so I think when we tighten the skin underneath the subcutaneous tissue, especially in arms and sometimes in legs, we're not addressing the dermis epidermis, that top layer, and so that can look crepey or more crepey. And Radius is a great treatment for that. Radiofrequency microneedling is an option, but they're all kind of real slow goes because you're counting on your collagen to rebuild.
Right. And then when you do Avéli, how like are the results permanent? Does it last forever? Do people get cellulite again?
You shouldn't get cellulite again. If you do develop dimples, it's usually in another area. So it's permanent in terms of I release those dimples, they're not growing back. So, you might have new changes with laxity, but not recurrence of cellulite. So it's a one and done, which is nice.
We love
Yeah.
way better than the cellulite creams.
Yeah, so a lot of cellulite creams will have caffeine or stuff in it that's temporarily tightening the skin. So it decreases the appearance of cellulite, but it's temporary. There are some body lotions that have like a retinol in them, which is helping to turn over your skin and build collagen and elastin. But those are, it's really hard to see a dramatic improvement with that. Should you use it and help strengthen your skin? Sure, but if you're waiting for some magical change, it usually doesn't happen. I've tried.
I've tried too, and I feel like I gave up after like 7 days. I was
Oh,
like, "This sucks."
I had a whole tube of one of those and I used it pretty religiously and I was like,
You
I
just
mean,
can't really see anything. I bought so many different products, and I
it's
feel like nothing ever.
I agree. I do think though, it's sort of like sunscreen, like you need to put it on. You're not going to like see a reverse of your wrinkles, but you're preventing
Yeah.
things. So using a cream with retinol, if you have the time and energy and money to do that, I would advocate doing that. I just am terrible about committing to lotion.
Especially on
Um,
the legs.
I know, like busy man.
Yeah, gotta
So
get dressed.
got time. No one got time for that. But if you're gonna do it,
Mm-mm.
or put a little tiny bit of your own retin-A or retinol into your lotion and mix it yourself, but that will all help. And then also using sunscreen. So sun damage. If you're just gonna go out there and go, oh, the UV's 8 today, and lay out in the sun with your legs, then it's almost pointless for the
Yeah.
laxity, not for the cellulite.
I know we talked about you can do it local. You can obviously do it under general.
Mhm.
Would probably choose to do that with another procedure though, right?
Yeah, so Avéli is done under local anesthetic. You can take an oral sedative, just need a ride home. You can use our Pronox, so laughing gas, very well tolerated. Very few patients are like, "Ugh, this was way worse than I thought." But if you're doing another surgical procedure, then yes, you're going to want to be under anesthesia because then it just drags everything out. So it's a great add-on if you're already doing something.
Yeah, I feel like when we first started, I think we have it down to a science now.
Mhm.
She's very like, I think taking the oral sedative, I highly suggest. I even put it in the email I send you. Just suggest taking it to be comfortable. And then when she first started, she numbed both sides at one time, and that did not work out as well. And now she does one side and then goes to another. And I feel like now between everything, people are super comfortable. I don't even think people even use the Pronox when it's out. They're just
Yeah.
like,
It's just there to, like, make them feel better that it's there if they
yeah.
need it. I
Yeah.
agree. Yeah, there were a couple little tricks. And then just, the more we know, the more we can prep our patients for what to expect, and so I think that helps a lot too.
Yeah.
But yeah, you're as soon as the bruising goes away within a couple weeks, you're good to go. Sometimes people will feel a little bit lumpy, but you won't see it. So that can take a month to 6 weeks. And so I usually see my patients back at a week to 2 weeks, and then again in a month, and then again at 3 months if we need to.
Yeah.
So yeah, one and done.
Is it the only current surgical cellulite treatment available?
Yeah, I think cellulase and sulfina were the other cellulite adjacent things,
Are they
which
lasers
no, there's
or
no
oh,
laser.
okay.
They're just different versions of they're like a Walmart Avéli. I mean, they're like the prototypes. They're just not as precise. I mean, it still might be around just because people probably have those machines. This is
Yeah.
you can see with that little wand, it's a one-time consumable. And then, the treatment can
So
range.
don't drop it.
Yeah, for reals. I know that little wand is over $1,000 a pop, but at least I'm not buying a $100,000 machine. We're not reusing these. This is the demo. Yeah, and it can be anywhere if you just have a couple of dimples, $3,000 to, $6,000, depending on how many. It's really, we kind of judge it based on how many areas we're treating, how many dimples I'm attacking. And then if you want to add, Radius is a great add-on for that. So that's a biostimulator. It's a filler that functions as a biostimulator, and we can put that in to kind of help improve laxity, smooth out some areas of irregularities, and add a little bit of volume. It's not a huge volumizer. If you want to fill out hip dips or something like that, then
You're gonna fill out my dimple with that, right?
yes, we are.
Yeah.
I know.
So we'll document my dimple journey. So I can go to our Instagram and watch my
Yeah,
butt.
she wanted Avéli, and so took her pants off at work, and I said, no,
Obviously.
that's not a cellulite. You just have a little dent from surgery or something. I don't know, just a dent. So we're gonna fill that out.
I didn't even notice the dent until she said something, and now I can't not see it. So
just like piercing your one ear, we need to get on that.
Oh yeah, she sewed up my ear hole, and now we keep forgetting to pierce it. So I've been wearing clip-on earrings everywhere.
It's crazy. I know, it just those things take like 2 minutes, but we're always busy in the office. So yeah, so patients are super excited about the results. They're happy to have this, they're more confident in either the white leggings or in their bikinis. And, we're in Southern California. That's important. So,
right. And we had was it 2 girls in the office when we got it? They're like, okay, 2 people can try it. Obviously, I put my hand up and got denied. But the other girl that did it, it looked so good.
Yes. Yeah.
Yeah.
It definitely did.
So good. I was like, dang.
Yeah. And she came back to work the next day. There's really no downtime. It's just you want to take it easy with your workouts.
Just take a couple days off or a day or so.
Yeah. Yep. Take it easy.
Don't expect to do it like lunchtime and go back to work after.
Yeah. Only if you work here.
Yeah, exactly. I will gladly do lunchtime procedures.
All right. I mean, I think that's it. That kind of sums up Avéli. It's a great treatment to get now, before the summer hits, especially in San Diego, because, we're in May gray, June gloom. So our summer doesn't really hit till July, August. So you have plenty of time to recover, not have any weird bruising, and look bikini ready for the summer.
Yes. Get bikini ready, ladies. And is this only for ladies, actually?
I mean, we've had a couple men come in. Men really don't get cellulite that often, and I haven't treated any, but it's doable. It's just nobody is bit yet.
Not yet.
And I prefer not to look at the male butt anyway, so it's fine.
I would also not like to massage the fluid out of a male butt. So
we're, a lady practice through and through to some degree.
Yeah, except for Dr. Chow.
Yes, she does love that male rhinoplasty.
She does.
All right.
And facelift.
Yes, and facelift. So, I think that's it. If you want to know more about Avéli, check out the information on our website. You can reach out to the office and chit chat with us, and Ava will be happy to give you more information, our coordinator, or schedule a consult with me, and then schedule your procedure, and you can hang out with me and Bree for a couple hours and talk about the Daily Mail.
And if you want to see my radius journey and you just want to see my butt, go on our Instagram and you can watch her fill in my dimple.
Yeah, coming soon.
Coming soon. Okay, we are scrubbed in
and scrubbing out. Catch you later.
Slay.
If you're listening today and have questions, need info about scheduling, financing, reviews, or photos, check out the show notes for links. Restore SD Plastic Surgery is located in La Jolla, California. To learn more about us, go to restoresdplasticsurgery.com or follow us on Instagram at restoresdplasticsurgery. If you enjoyed this episode, please share it and subscribe to All the Bees on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts.